So the biopsy is the only test you can do to confirm if there is cancer, because the only way we can confirm cancer is to get a cells sample and to see if there are actually cancer cells in it. So the only way to do that is through a biopsy. So it's very important for us doctors, as oncologists, to know what type of breast cancer it is. So all these receptors are for us to know what type of breast cancer it is, so then we know how to treat it. So firstly, the thing to reassure people is that not everybody needs chemotherapy. In oncotype test, we test the actual cancer cells themselves, and we look for whether there are any common breast cancer mutations that are in the breast cancer cell.
Halo teman-teman, welcome back to Friendlink Podcast. Senang banget nih bisa ketemu sama kalian lagi. Hari ini kita akan bahas sesuatu yang sangat dekat dengan banyak perempuan, bahkan mungkin dengan orang-orang yang kalian sayangi, itu kanker payudara. Khususnya pada saat proses awal pemeriksaan dan diagnosis yang biasanya kita pasti ngerasa deg-degan, takut, bingung. Kayak pertanyaan seperti, kalau nemu benjolan aku harus apa? Istilah kedokteran yang bingung banget seperti HER2, ER, PR itu sebenarnya apa sih? Pengobatannya nanti gimana dan apa yang harus aku lakukan? Dan itu semua wajar banget bikin kita takut dan bingung. Tapi justru karena itulah kita ada di sini supaya kamu gak jalan sendirian. Kita belajar sama-sama. Hari ini kebetulan kita kedatangan tamu yang luar biasa yang menjelasannya sederhana, jelas, dan langsung dari ahlinya. Beliau adalah Dr. Shang Yeap, Senior Konsultan Medical Oncologist dari Icon Cancer Center di Singapura. So, teman-teman, ambil kopi, matcha, atau apapun yang bikin kamu nyaman. Yuk kita ngobrol dan semoga membuat kita lebih ngerti dan kita nggak bingung lagi harus melakukan apa. Hi Dr. Shang Yeap, it's really nice to have you here. How are you today, Doctor?
Hi Lenny, it's good to be here. I'm glad to be able to be here to have this conversation with you.
Yes. So actually we received many questions from the patient and I'd love to go through some of them with you. Hopefully today we can help our listener to feel a little calmer and let's get about the whole process. So let's start from the very beginning of the journey, Doctor. When someone finds a lump or gets an abnormal mammogram, what usually happens next? What are the first steps the doctor will doing to confirm whether it's cancer or not?
Okay, so often some patients we may be told that they have an abnormal mammogram, or what we call a breast screening mammogram. So this is a simple screening mammogram that many patients or many normal people will do. After, if you get an abnormal result, you then may be asked to repeat the mammogram again, and you may do a more special mammogram to check whether or not is really an abnormal test. Usually with the mammogram, you may also be asked to do an ultrasound as well. So the difference between a mammogram and an ultrasound is that a mammogram gives you quite sometimes a general view of the breast and then picks up like possible abnormal cells like calcifications. The ultrasound, on the other hand, is a more focused examination. So you may look at the abnormal part that's noted on the mammogram, and then you focus on those parts to see whether or not those abnormal calcifications, for example, on the mammogram may turn out to be cysts, or are they actually maybe cancer cells. So usually the next step would be then to have an ultrasound after an abnormal mammogram. Now sometimes also you might need an MRI of the breast, and then eventually if there's suspicious that there is a cancer cells, then they may need a biopsy of the breast as well.
Speaking of the test, like as you mentioned, right, which is like quite a lot, like a mammogram, ultrasound, or maybe MRI. And I think, yeah, again, the word that most people scared is the biopsy. I think to determine whether it's a cancer or not. So, but some also believe that the biopsy can cause cancer to spread. You know, like, is it actually true? And whether it actually happens during the biopsy, and actually what importance does it give to you?
Okay, sure. So the biopsy is very important because it is, at the end of the day, whether you do a mammogram, an ultrasound, or MRI, you can never be 100% sure if there is cancer. So the biopsy is the only test you can do to confirm if there is cancer. The only way we can confirm cancer is to get a cells sample and to see if there are actually cancer cells in it. So the only way to do that is through a biopsy. Now, biopsy, as you know, It involves putting a needle into the abnormal part of the breast and then getting some tissue out. Generally, these days, biopsies are very safe, right? They are all done by doctors who have been trained to do this many times. So the fear of causing the cancer to spread is it rarely ever happens. So it's not something that we worry about too much, especially when it comes to breast biopsies.
Once the biopsy result come back, the terminology can feel like overwhelming for the patient. So can you explain like the terms like ER or PR or the HER2, whether it's a positive or the negative in the simple language? Maybe how they can guide the treatment as well.
Yeah, okay. So if the biopsy confirms that there is cancer, then the next thing we need to find out is what type of breast cancer it is. So we have generally about 3 different types of breast cancer. So we have what we call the hormone positive breast cancers, the HER2 positive breast cancers, and the triple negative breast cancers. So once we have the cells, we will do these receptor immunohistochemistry stains. So these receptors, you might see on the report, the estrogen receptor, progesterone receptor, the HER2 or ERB2 receptor, and then, these are the 3 receptors. So if you have an estrogen receptor that's positive, or a progesterone receptor that's positive, then you have a hormone positive breast cancer. If you have a HER2 receptor that's positive, HER2 is just a protein around the cancer cells. If you have a lot of that, then you have a HER2 positive breast cancer. And if you don't have any of that, meaning that your estrogen receptor, your progesterone receptor, and your HER2 are all negative, then you have a triple negative breast cancer. So all this is important because all these types of breast cancers behave differently and they are all treated differently. So it's very important for us doctors, as oncologists, to know what type of breast cancer it is. So all these receptors are for us to know what type of breast cancer it is, so then we know how to treat it.
Once doctor know the specific type of a breast cancer, you can also understand which treatment is the most suitable for the patient. So there are treatments like the chemoterapi or the targeted therapy or the hormonal therapy and also the immunotherapy. Could you explain in the simple terms what these treatments are and how they actually work?
Very good. So for example, if your estrogen receptor and your progesterone receptor are positive, you will almost definitely need hormonal therapy. So hormonal therapy are usually tablets that may interfere with the hormone to kill the cancer cells. So often these hormone therapy is just tablets for patients. But immunotherapy, for example, is given sometimes to what we call triple negative breast cancers because triple negative breast cancers respond well to immunotherapy. Other things like surgery is something that almost all early stage breast cancer patients will need surgery. The only people who don't need surgery are those who unfortunately have more what we call late stage breast cancer, and then they may not need surgery.
I think lately we also hear like some more patients will be offered some additional tests. So the tests like BRCA1 or BRCA2 or genomic tests such as Oncotype DX. So actually, how do they help the personalize the treatment?
All advances in the treatment of breast cancer, right? So these are all latest things that we are doing to treat breast cancer. So we talk about the Oncotype test first, which some people may have heard of. The Oncotype test is a special kind of genetic test or a genomic profiling test. So an Oncotype test, we test the actual cancer cells themselves and we look for whether there are any common breast cancer mutations that are in the breast cancer cells. So once we check for all these mutations, we then get a score. And if you have a very high Oncotype score, you generally have a more aggressive type of breast cancer. Whereas if you have a low Oncotype score, then you have a less aggressive type of breast cancer. So if you have a very high score showing that you have a very aggressive cancer, you will generally need chemotherapy. Whereas the other way around, if you get a very low score, sometimes you will not need chemotherapy, you may only need hormonal therapy. So the Oncotype test helps us to decide whether a patient has an aggressive cancer or whether or not they need chemotherapy. So that's a very important test because of the Oncotype test, many patients have been able to not have to do chemotherapy. Because by doing the Oncotype test, if we find that, oh wow, the result is very good, very low, the cancer is not aggressive, many women would not have to do chemotherapy. So that's Oncotype test. Now the other test that you mentioned, Lenny, is the BRCA or BRCA test. Now this is a different type of test. This test is to check for whether the patient has a hereditary mutation, meaning that did they inherit some special genes from their family, from their parents, that caused them to have this breast cancer. So this test is to find out whether or not a patient is at high risk of having breast cancer, whether it was because they have a BRCA gene or a genetic condition that caused them to have this breast cancer. So this particular BRCA test is different from the Oncotype test. The Oncotype test helps us to decide what sort of treatment the patient needs, whereas the BRCA test tells us a bit more information about whether this patient is a special genetic mutation that caused them to have the breast cancer. We do this test mainly to also help our treatment of the patient, because some patients, if you find out that you got test, you may be advised to do extra surgery, because you may have a high risk of getting breast cancer again on the other side, on the other breast, and you may also have a high risk of getting other types of ovarian cancer. So you may need another breast surgery on the other side, as well as maybe a removal of the ovaries. Also, the BRCA test sometimes is done because there are some new drugs that we can sometimes use that may only work for patients with the BRCA mutation. So these genetic tests are also something that we do for patients who we suspect are at high risk of having an inherited mutation.
Dr. Yeap, many people still think the chemotherapy is always the main treatment for the breast cancer. Does the chemotherapy is still something that every breast cancer patient is to do, or has the approach changed in the modern era?
Yeah. So firstly, the thing to reassure people is that not everybody needs chemotherapy. That's why we do all these tests, like finding out whether all the things we talked about earlier, finding out what type of breast cancer it is through all the estrogen receptor, progesterone receptor, doing the Oncotype test. All these things, right, help us to decide whether the patient needs chemotherapy. Now, so for some patients, if they have an early stage breast cancer, they have a hormone positive breast cancer, and they have a low Oncotype score, many of them will not even need chemotherapy. So we try to only do chemotherapy for those that really need it. Now, chemotherapy has also improved. There have been many trials. The last time we used to give a lot more chemotherapy, but in the last few years, we found that we can sometimes also lower the chemotherapy. So we find that we don't have to give as much chemotherapy as we used to in the past. So it's made it a lot more tolerable. For example, for HER2 positive breast cancers, we used to give very strong chemotherapy drugs, anthracyclines. But then now we find that many of them actually do well without these strong chemotherapy drugs. So they do find it easier. So there's also been a lot of breakthroughs in using less chemotherapy for breast cancer these days to make it more tolerable for patients.
For all those who are still waiting for the result, the emotional side can be the hardest part. So actually, what message would you share with someone who is waiting for the result, or maybe the newly diagnosed, to help them to stay hopeful?
Okay, all right. So I think the one thing that, especially for breast cancer, that you must stay hopeful about is that breast cancer has become one of the most curable cancers among all cancers. So what we call the mortality rate, that means the chances of people dying from breast cancer, have improved a lot over the last few years. The reason being for this is that we are catching cancer much earlier than we used to before, and the treatments have also improved. So even if you have been diagnosed with breast cancer, it is something you can be quite positive about, because the chances of beating this cancer are very good. So it's certainly something you must stay positive about. Now, other ththings also to take notice of is that you are never alone, right? The cancer journey is not something that you have to be worried that you're all by yourself. Your family members are there, the healthcare professionals, your doctors. There's many support groups that are available these days, many resources available to walk you through, so you don't ever have to feel that it's a journey that you take alone. And certainly, it's something that we encourage you to have. So strong social supports are very important if you have been diagnosed with cancer. So generally, there are a few good advice that we do give to patients that will reduce their risk of getting cancer, because we do believe that cancer risk can be improved by just adopting some good habits. So one very good habit that we do advise for everybody is exercise. So regular exercise has been shown to lead to a lower risk of getting cancer. So we certainly encourage exercise, and exercise doesn't have to be very heavy exercise. Even just a moderate exercise like brisk walking, half an hour every day, 5 times a week, that has been shown to already lower the risk of getting cancer. So exercise is something we definitely encourage. Other things we also encourage are things like eating healthily in general. In general, we tell you eat less, fatty food, oily foods, less of the bad carbohydrates. All these are all just good general healthy advice that is good for not just in terms of lowering the risk of getting cancer, but also in terms of preventing other health problems like heart diseases and strokes. So generally, a balanced, healthy diet is something that we always encourage. Thirdly, in general, we try to encourage patients lower their alcohol intake or to abstain or to not take alcohol, because in general, alcohol is a risk factor for cancer. So if you are a very heavy drinker, certainly you have a higher risk of getting cancer. So we do try to encourage to limit the alcohol intake. And then, of course, the big one is smoking, right? So smoking is a strong risk factor for many types of cancers. So we also encourage people to cease smoking if possible, if they have been a smoker, because that will definitely lower their risk of getting many types of cancers.
Thank you so much, Dr. Shang Yeap, for sharing your insight in such a warm and easy to understand for us. It's truly helping us. Oke, teman-teman, aku harap obrolan hari ini bisa bantu kamu ngerasa sedikit lebih tenang ya, bahwa proses pemeriksaan itu bukan untuk nakut-nakutin, tapi justru untuk melindungi kita. Karena semakin cepat kita tahu, semakin cepat juga tubuh kita bisa dibantu dan diobati. Yang artinya semakin cepat juga kamu bisa sembuh. Kalau kamu lagi menjalani pemeriksaan, lagi nunggu hasil, atau lagi merasa dunia ini terasa berat, ingat, kamu nggak harus kuat sendirian. Pelan-pelan kita satu langkah kecil di setiap hari. Dan Friendlink akan bantu memastikan langkah itu tepat, mulai dari dokter, rumah sakit yang sesuai, atau pendampingan selama pengobatan. Thank you for listening to Friendlink Podcast. Jangan lupa share episode ini ke siapapun yang mungkin sedang butuh mendapatkan informasi yang tepat. Aku Lenny, sampai ketemu di episode berikutnya. Jaga diri kalian dan sehat selalu.